my name is Brittany. I'm going to be the nurse for today. Can you go ahead and tell me your name and your date of birth?
Sure. My name is Lucy Ornez, and I was born January 15th, 1960.
Okay. Today I'm going to go ahead and do a head-to-toe assessment, so I'll be taking a listen to you. I'll be inspecting, percussing, auscultating, and palpating. And as I move through the body, I'll go ahead and explain a little bit more into detail what I'm going to do, okay?
Okay.
So I'm going to start off with assessing your head, and I'm going to go ahead and look at your face. I'm going to look at the palpable fissures, so I'm going to look at the lines on her eyes to make sure that they're symmetric, and then I'll go ahead and look at the nasolabial folds, which are lines from the nose to the lips, to make sure that everything is symmetrical. I'll go ahead and look at skin color, if there's any lesions, again, symmetry. And then the next thing I'm going to do is palpate the head and the scalp. So I'll go ahead and I'll feel around for the bones. I'll feel the parietal bones and then the occipital bones on the back of her head. And then I'll go ahead and feel for the mastoid process on both sides, which is the bone right behind her ear. And make sure that they're symmetric bilaterally. And then I'll go ahead and feel for the temporal arteries, and make sure that I can feel a pulse. They don't look tortuous, they don't look bulging, and they pulse bilaterally. The next, I'm going to palpate the temporomandibular joint. I'm going to do this. I'm going to push on both sides of her face, and I'm going to have her open her mouth and close, and open, close, and move your jaw side to side. Any pain?
No.
Okay. And we don't want any pain. There's good range of motion in her jaw. And then the next thing I'm going to have you do is I'm going to test for cranial nerve 5 and 7. 5 is the trigeminal, and I'm going to ask you to clench your teeth. And I'll go ahead again and feel for the muscles, make sure that it's even on both sides. Okay, and you can go ahead and relax. And then cranial nerve 7, which is the facial nerve. I'm going to ask you to smile, and it's symmetric. And then can you puff your cheeks? Okay, very good. And now I'm going to just tap on her cheeks. Yes. And when she exhaled, her cheeks went in and she puffed the air out, and her cheeks were symmetric. And then can you go ahead and wrinkle your forehead? Very good. Okay. Now we're going to go on and move to the eyes. Okay. So we're going to be testing cranial nerves 3, 4, and 6. And 3 is the oculomotor, and 4 is the trochlear, and then 6 is the abducens. And I'm going to test her extraocular eye movements by the diagnostics positions test. So what I'm going to have you do is kind of face the camera with your head. Okay, so I want you to look at the tip of the pen light, and I'm going to move the pen, but keep your head still, and just follow the pen light with your eyes. Now I'm going to move in a clockwise motion. Very good. And her eye strength is good. There's no lagging in either of her eyes. And now I'm going to test for the visual fields by confrontation. So I'm going to ask you to cover your left eye. And I'm going to cover my right eye. And I'm going to take this pen light. And I don't want you to move your head. I want you to look straight ahead. I want you to say now when you can see the tip of the pen light, okay?
Mm-hmm. No.
Okay, I could see it as well.
No.
Okay, me too.
No.
Okay.
No.
Okay, me too. Now I'll go ahead and switch eyes. And I'm going to do the same thing. Let me know when you can see it, okay?
No. 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 No.
Okay, very good. Okay, and the vision fields by confrontation test for peripheral vision, and by both of us covering our eyes, I can determine when I can see the pen light and if her peripheral vision matches up with mine, assuming that my peripheral vision is normal. And ours matched up, so I would consider it normal. The next thing I'm going to do is check for her pupils and the response, the direct and consensual response. The direct, I'll go ahead and take my pen light and shine it into one eye, and the light that is shining into that specific eye, the pupil should constrict. And then the consensual response is when the eye that isn't being checked with the light, that should constrict as well. So if you go ahead and look straight ahead, I'm going to go ahead and shine the light in your eye real quick. Okay, so the direct response is positive. Her pupil did constrict. Now I'm going to go ahead and check the direct response in her right eye. And it did. So now I'm going to go back and shine the light in her left eye again, but I'm going to check the consensual response in her right eye. Okay, and it did constrict. Okay, and there was a consensual response in her left eye. Okay. The next thing that I'm going to do is check for her ears. First, I'm going to inspect. I'm going to make sure that, do you mind turning a little more facing?
This one?
Yeah, facing the camera. Okay. I'm going to make sure that they're symmetric. There's no abnormal redness, lesions, any swelling, any abnormal scars. I'll go ahead and just check from what I can see if there's any drainage. And there's not. And now I'm going to just pull on your ears a little bit. Can you tell me if there's any pain?
No pain.
Okay, now I'm going to push on the tragus. Any pain, any tenderness?
No pain, no tenderness.
Okay, that's what we like to hear. Okay. The next thing I'm going to do is look at the nose. I'm going to inspect and then palpate, so I want to make sure that it's symmetrical. It doesn't appear to be broken. There's no pain or tenderness to touch. Any pain or tenderness?
No.
Okay, and now I want to just do a quick check, make sure that there's no drainage, no bleeding, which there is not. Now I'm going to check for the nasal patency, and I'm going to do that by pushing on one side of her nose and asking her to breathe in. And you can breathe. It's patent. And I'm going to let go, and I'm going to do the other side. Okay, very good. And now I'm going to assess her mouth. So I'm going to be looking at the lips, the gums, the tongue, the oral mucosa, and the teeth. Okay. And just from the outside, I just want to make sure that there's no cracks, no fissures, any lesions. The color is pink. We want to make sure there's no cyanosis. So now I'm just going to look at the inside of her lips. Make sure, once again, the color, you want to check to make sure that it's pink, there's no lesions. The skin is intact. Again, the top, same thing. You want to check the skin color, any lesions. And again, while doing this, I want to make sure I'm looking at the gums. The gums appear pink, non-tender, they're not red, swollen. I want to check for any gingivitis. And then I want to look at the teeth as well and make sure that they're clean, they're white, they're straight, there's no loose teeth anywhere. And then I want to go ahead and just look at the tongue. Can you open up a little more? Okay. And can you lift your tongue up? I want to look at the floor of the mouth. I want to look at the frenulum, make sure that that is midline, it's intact. Again, there's no sores, and that the mucosa is pink. Okay, you can let your tongue down, and then go ahead and stick your tongue out for me. Okay, so her tongue is midline. Can you go ahead and move it side to side? Okay, very good. So the muscle strength on her tongue is equal, it's bilateral. Can you go ahead and push against your cheeks with your tongue for me? Okay, other side. Again, that tests for muscle strength as well. And can you go ahead and open your mouth? And her tongue, it's pink. It has a smooth surface, normal to inspection. And then I'm just going to go ahead, I'm going to take my pen light. I'm going to observe the posterior pharynx, the throat. Okay. And can you go ahead and say ah for me? Okay. When she says ah, the palate as well as, you can close your mouth, as well as the uvula should move upward midline. The uvula should stay midline. And the elevation of the palate and the uvula test for cranial nerve 10, which is the vagus. Okay. Okay. The next thing I'm going to assess is your neck. So I'm going to start by assessing your thyroid. Can you scoot a little more? This is where I'm going to get behind you.
Like this?
Yes.
Okay.
Okay, so you can test the thyroid two ways, in a posterior way and an anterior way, and I'm only going to be doing it from the posterior approach. And how I'm going to be doing this is I'm going to go ahead and ask for you to Move your head a little bit down and to the right. And I'm going to feel, if you feel for landmarks, there's cartilage and there is the thyroid cartilage, which is known as the Adam's apple, and you can feel for the trachea, which you can feel horizontal rings in the throat. And then what I'm going to do is I'm going to feel for those landmarks. I'm going to place my fingers to the side of them, and with her head slightly to the right, I'm going with my left hand to gently push towards the right, and I'm just going to palpate without her swallowing. And now I'm going to ask her to swallow. Okay? And I didn't feel anything, which you should not be able to feel a thyroid. Okay. So now I'm going to have you do the same thing again. Just tilt your head to the left. This time I'm going to take my right hand and push towards the left. And I'm just going to palpate without her swallowing. And now I'm going to have her swallow. Okay? And if you could take a sip of water for me. And while she takes a sip of water, I'm still going to palpate. Okay? When she swallows, I should, if the thyroid is palpable, I should feel it move underneath my fingers when I'm palpating. And I did not feel her thyroid. The next thing I am going to assess is the lymph nodes. Okay. So the first ones, you want to palpate just in front of the ears. This is the preauricular. And then right behind the ears is the posterior auricular. And then more towards the back of the head is the occipital. And there's one below the ear, more on the anterior side, the jugulo-digastric. And then the submental, you can just use one hand for this one. And then the submandibular, which is underneath the jaw. And then you have the deep cervical chain. And then a little behind that, you have the posterior cervical. And then closer up to the jawline, you have the superficial cervical. And then you have the supraclavicular. And you shouldn't feel any firm lymph nodes. They shouldn't be swollen. They should feel symmetric on both sides. And now what I want to do is palpate the carotid artery. I'm going to do this. I should do this with the same hand as the side that she's on. So I'm going to use my left hand for her right carotid artery because I'm on this side. I don't want to push too hard because I don't want to compromise the arterial blood flow to the brain. Okay, and it's strong. And then again, I want to palpate on this side. And they're strong. The next thing that I'm going to do is auscultate. I want to listen to the carotid arteries, and I'll be using the bell of my stethoscope because I want to assess for any bruits. So I'll go ahead and make sure that's clean. Warm my stethoscope up. And when I do this, I'm going to ask her to take a deep breath and to hold it. Okay, and breathe. And again, deep breath. Okay. And by holding her breath, that will eliminate any extra sounds that I might hear through my stethoscope. Okay, and now I want to go ahead and listen to her heart. Okay, you could go ahead and sit on the bed for this. Okay. And you can examine the heart in a few different ways, depending on exactly what you're looking for. The patient can be sitting, they can be in a supine position or the left lateral position. What I'm going to do first is I'm going to palpate her pulses. I'm going to do her radial. So I'm going to feel on both of her wrists. And she has a strong pulse. The next one, I want to go ahead and palpate the posterior tibialis, which is on the inside of the ankle. Okay. And those are strong. And then the next one is the duralis pedis, and that's on the top of the foot. Can you put your feet up a little bit? At least one of them. Right there. On both feet. Okay? Thank you. And then testing for the pulses down to the feet. That's good to indicate good circulation throughout the whole body and the most distal places. So the next thing I'm going to do is auscultate the 5 areas of the heart. I'm going to use the diaphragm of my stethoscope. In the first place, I'm going to listen to the aortic, which is the second intercostal space on the right side, and you want to make sure that you avoid any bony prominences. So I'm going to count down 2 spaces, and I'll listen there. The next spot, I'm going to listen to the second intercostal space on the left side. So I'm going to count 2 down, and this is the pulmonic. The next is the tricuspid, and that is mid-clavicular sternal area. It's on the lower side, a little bit to the left. So again, mid-sternal area to the left, the lower sternal. okay? And then you have the mitral, which is mid-clavicular line to the left, and it's 5 intercostal spaces down. Again, try to avoid any bony prominences. And for women, you might want to kind of displace or move the breast over a little so you have a better reading of the heart. And then Erb's point is by the pulmonic, in between the pulmonic and the mitral valve. So if the pulmonic is the second intercostal, and then the mitral is mid-clavicular fifth, it's in between. Again, checking to make sure that you're avoiding the ribs. Okay. And to hear S1, you would use the diaphragm of the stethoscope, like what I just did, and you would be listening to the apex of the heart, which is the mitral area. It's the bottom of the heart. For S2, you would use the diaphragm, and you would be listening to the base of the heart, which is the pulmonic, the top of the heart. And then for S3 and S4, which are abnormal heart sounds, you would listen with the bell of your stethoscope, and you would place it over the apex or around the mitral area of the heart, because the ventricles work the hardest, and that's usually what S3 and S4 indicate. The next thing I'm going to do is assess your chest and your lungs. Okay. And then for this, I'm going to have you sit facing that way. Yes.
Okay.
Okay, so I'm gonna percuss the posterior lung fields. Okay. And I want to make sure that I'm not hearing any dullness. And again, you want to make sure that you're not on any bone. So I'm going to go ahead and use the 1-to-1 finger technique. I'm going to use my left hand as my base and then my right hand as my striker. So I'm going to start on the left side. I'm going to percuss, and I want to make sure that I don't feel any dullness. Now I'm going to go over to the other side, percuss again, so I have a comparison. And then I'm going to go down a little bit, move over, okay. Other areas that can be percussed are also the diaphragmatic excursion, and that's also on the back. or I apologize, that's on the front, on the anterior. You could go ahead and turn around. Actually, you can sit on the bed. Sorry.
Sit on the bed?
Yeah.
Okay.
You got it.
Yes.
Okay, so for a diaphragmatic excursion, you would go ahead. This is to determine where the abdominal viscera separates from the lungs. And how you test for this is you would look at okay. Okay, my apologies. My apologies. The diaphragmatic excursion is on the posterior side, and can you stand up and face that way?
Sure.
And just for the purposes of this video, so you can see the proper technique, I'm having her stand or sit so it's visible. So what you would do is you want to make sure that when you hear the sound going from resonant to dull, you would make a mark. So you would go ahead, avoiding bone again, and you would percuss. So when I hear it, a change of sound, I'll go ahead and mark my area. I'll go ahead and do it again on the other side. I'll go ahead and mark both of those areas. And then I'll start from the bottom, and I'll go ahead and percuss until I hear a dull sound. So I'll go ahead and make my mark, and then I'll do the same thing on the other side. I want it to be mid-clavicular from the back. Okay, so I'll make my mark, and if these are my two marks, then I'll go ahead and take a ruler, and I would measure in centimeters the area where those two marks fit, and they should be equal. And then another area that you can percuss is the anterior chest. Okay, you go ahead and turn around. And again, you just want to make sure that you're avoiding the bone, and you want to check for any dullness. Okay. The next thing you want to check for is you want to percuss for the CVA, which is the costovertebral angle. Okay, and do you mind turning around for me one more time? And this is around the 12th rib on the back side, and you want to percuss on both sides for the kidneys. You want to make sure that there's no pain or tenderness. Any pain?
No.
Any pain?
No.
Okay. The next thing I'm going to do is I'm going to perform for tactile fremitus, and I'm going to use both of my hands, the balls of my hands, and I'm going to place my hands on her back on certain positions. As I do, I'm going to ask her to say 99, and it's going to test for a palpable vibration. Okay? Okay.
99. 99. 99. 99. 99. 99.
Okay. All right, and then you can also perform this on the anterior chest as well, and it will test for the same thing. The next thing, I am going to auscultate her lungs. So what I'm going to have you do is take a deep breath. And breathe through your mouth, okay? And as I'm doing this, I want to get all aspects of her back and do a side-to-side comparison. And I want to make sure that I get the lateral sides as well. Okay, if you can turn around for me, please. I'm going to go ahead and auscultate her lung sounds anteriorly. Okay. And again, for women, you may need to move the breast to hear a better reading. Okay. The next thing I'm going to do is assess the abdomen. Normally, I would have the patient lying down, but for purposes of technique, I will have her standing so you can see everything. I will go ahead and expose the areas as needed. Again, for the purpose of this video, she will remain clothed. I will go ahead and inspect the abdomen. Make sure I would look at the contour. If she's lying down, I want to assess how her head sits with the rest of her body. I would go ahead and look at symmetry, look for any hernias, any bulging. I'd look at the umbilicus, see if there's any umbilical hernias. I would check to see if it's inverted. I would check to see if there's any scarring at all. I would look at the skin, the color, make sure that it's consistent with the rest of her body color and appropriate for her ethnicity. I'll make sure that her skin is smooth, even. I would look at the pulsation or movement of the aorta in the epigastric area, and I shouldn't see a pulsation or movement. I would look at the hair distribution, and then I would look at the demeanor. If she's lying down, she should be relaxed, shouldn't be fidgety or uncomfortable. The next thing I'm going to do is auscultate for vowel sounds. And you usually want to start in the right lower quadrant because that's where the majority of vowel sounds are heard. Is that heard?
No.
Is it tender?
Well, a little, yes.
Okay. Okay, so it's tender in her right lower quadrant. She has hypoactive vowel sounds. The next thing I'm going to do is auscultate for vascular sounds. This includes the aortic, renal, iliac, and femoral sounds. And I'm going to use that I'm going to assess that by using the bell of my stethoscope. And I'll look for the aortic. It's underneath the xiphoid process, midline. And I want to assess for any bruits. The renal are just next to it and below. The iliac is below the belly button on each side. And then the femoral is below that. And no buries. Okay, and then I'm going to perform a general percussion of the area. And I want to make sure that I get the whole area. Tender?
A little bit tender.
Okay. And you want to make sure that you're getting all quadrants. And with general timpani, you should mainly hear timpani over dullness. The next, I'm going to percuss for the lower liver border. And by doing this, I am going to find the right midclavicular line, and I'm going to go down to the lung area where there's resonance, and I'm going to percuss, and I'm going to percuss down until I reach tympani. When I do, I will mark my area, and then I'll go ahead and go from mid-clavicular line, and I'll start from tympani on her lower abdomen, and I'll go up until I reach a dullness, and I'll make my mark there. I'll get my ruler, I'll measure the mark, and it's about 6 centimeters, and around 7 is normal for females. Okay. What I'm going to do next is palpate the abdomen with light palpation. So I'm going to do that by using my 4 fingers, and I'll go ahead and percuss about 1 centimeter.
Little.
Okay. You want to make sure that you get all areas of the stomach, getting each quadrant. Okay. The next is deep palpation, and you want to use both hands for that, and you want to go about 2 to 3 inches. Okay?
Okay, that hurts.
Okay. And now I'm going to palpate the liver again. She should be lying down for this. What I'm going to do is I'm going to stand on her right side. I would take my left hand and put it under around the 12th rib to support her back. I'd go ahead and put my hand on her right upper quadrant, and I'd feel, and I'd ask her to take a deep breath and exhale. And again. And as she takes each breath, I'm going to palpate and feel for the liver. And it shouldn't be palpable. Okay? Then next I'm going to palpate for the spleen. And I'm going to do that by reaching my left hand over if she were lying down. Again, I'd feel for the 12th rib. I'd go ahead and place my right hand in the position towards her axilla, and I'd go ahead and ask her to take a deep breath. Okay. And then the next I would palpate for the right and left kidneys, and I would do that by, do you mind turning around for me, please? Finding the 12th rib, taking my hand, and then doing a quick fist blow to the area. Do you feel any pain?
No.
And then again on the other side. Any pain?
No.
Okay, very good. You can turn around. Then next I'm going to palpate the aorta, and it's midline below the xiphoid process to the left. So I'd go ahead and I'd palpate. And then you can go ahead and measure how wide it is. And about 2.5 to 4 centimeters is normal. Okay, so I'm going to have you, I'll sit the patient up for the neuro assessment, and you can go ahead and sit on the bed or the chair. Just face
the camera.
Yes. Okay. Okay, so I'm going to test cranial nerve 11, which is your spinal accessory. So what I'm going to have you do is I want you to push against my hand, okay, with your head. Okay. All right, now the next I want you to shrug your shoulders against my hands. Okay? And if even, her muscle strength is even. Okay, now, do you mind sitting on the bed for me? Here? Okay. The next thing I'm going to do is test the upper extremity fine motor and coordination. I'm going to do this by asking you to pat your knees first with the palms and then the back of your hands, and I want you to do it as fast as you can. Okay, so everything is even. Her coordination is good. And now I want you to do the finger to thumb test. What you're going to do is you're going to take your thumb to each of your fingers. Okay. The next test is the finger to finger, and you can keep your eyes open. What I want you to do is I want you to touch my finger with your finger and then touch your nose. Yes. The next, what I'm going to have you do is the heel to shin test. Okay, if you go ahead and lie down and scoot back a little bit, what I'm going to have you do is straighten your legs out. Both of them, yes. And then with this foot, I want you to take your heel and move it straight down this shin. Okay? Now I want you to do the same thing with the other foot. Very good. So it was midline. She didn't have any problems with it. Okay, you can come in and sit up. The next thing I'm going to do is test for reflexes, and I'll do that if I were to test her triceps. I would hold her arm, I would have her relax her arm, and then I would go ahead and find her tendon by her elbow, and then I would hit that tendon and her arm should go out. The next one is the patellar reflex, and I would find her knee, her patellar, and I would find the tendon, and I would hit just below that, and then her foot should go out. The last one is the Achilles tendon, and that's right behind the ankle. If I get right behind her ankle, if I feel for the tendon, and then hit her reflex there, then her foot should jerk. Okay. This one I'm going to test your feet, the toes.
So my toes up here?
Yes. The next thing I'm going to do is assess for the position sense of the great toe bilaterally. So what I'm going to have you do is close your eyes. I'm going to move your toes, and I want you to tell me which direction I'm moving them in, okay?
Up, down, this way, my left,
Yes.
my right.
Okay, very good. And now, to assess for the vibratory sense in the great toe, if I had a tuning fork, I would stimulate that, and then I would touch it to both of her great toes, and I would ask her to tell me when she feels the vibration and when she feels it stop. Okay, and now I'm going to ask you to stand. And I want to assess your gait. So if you can, for me, walk to the closet door and then walk back. Okay, very good. So her gait was steady. She wasn't staggering. She wasn't shuffling. Now what I'm going to ask you to do is start back here.
Okay.
And I want you to walk backwards with your toe touching your heel, your big toe touching your heel. Okay? Very good. Okay. And that completes the head to toe assessment. Thank you very much.